The pituitary gland is found at the base of the brain. It is not part of the brain, but it is controlled by the brain. Benign tumors arise from the pituitary gland. We don't know why they form, but they do form, and they can grow to a large size. Some of the tumors secrete hormones, and because they secrete hormones, they can cause symptoms, and they can be diagnosed even when they're quite small. Some of the tumors do not secrete hormones, and they can grow to a large size and press on the nerves to the eye and cause problems with vision. Women who have pituitary tumors frequently have abnormal menses. Sometimes they have discharge from their breasts. Sometimes people will have a sudden growth spurt and an enlargement in their hands, in their glove size or their hat size. And sometimes people will have visual loss. A pituitary tumor that does not secrete hormones can grow for a long time and not cause symptoms until there is visual loss. The pituitary tumor is most often diagnosed with an MRI scan. Again, this is done with contrast because the tumors frequently will light up. When they're very small, they may not show up very easily. But when they are small, they are often secreting hormones, and blood tests can be done to see what hormones are being secreted. Sometimes a pituitary tumor will cause compression of the normal pituitary gland and not enough hormones are being secreted. This can also be diagnosed by blood tests. If a patient has difficulties with their vision, a formal visual test needs to be done to see how much visual loss has been created by the tumor. If a pituitary tumor is found, it may or may not need treatment. A pituitary tumor that does not secrete hormones and is small, and perhaps is found incidentally, does not require any treatment but needs to be followed. It may or may not grow over time. If a tumor is secreting hormones and causing symptoms because of the hormonal release, it needs to be treated either with surgery or with gamma knife radiation treatment. If the tumor is very large and pressing on the nerves to the eye, it needs to be treated first with surgery, and if there's any tumor left over, that needs to be treated with gamma knife radiation treatment. The risks of surgery for a pituitary tumor are small. Usually a pituitary tumor can be removed through the patient's nose. The tumor can be removed and the pressure taken off the nerves to the eye. If the tumor is very large, further injury to the nerves to the eye could happen, but that is rare, and usually after surgery, patients have an improvement in their vision. The hormonal function of the pituitary gland can be affected by surgery. Not often, but sometimes, the normal hormonal function can be lost. This is treated with replacement hormones. Surgery is often considered for pituitary tumors, often when they are large and the optic nerves need to be decompressed. Once the optic nerves are decompressed, patients often have an improvement in their vision. Surgery is not indicated if the tumor is not large and not causing symptoms. The risks are related to a worsening of the vision and possibly injury to the pituitary gland. If the pituitary gland itself is injured, the patient may not make the normal hormones that their body produces. This can be treated with medication and hormone replacement.